Hey guys, Dr. Stavros here. If you're in med school and you need help with USMLE test prep, in less than 60 seconds, I'm going to show you a live 1-hour USMLE study session. I'm going to show you techniques and shortcuts you can use to instantly boost your USMLE score. You're going to get live analysis of me walking you through AMBOSS questions, where I will show you how to exactly apply the content you learn in med school to the exam. You're going to learn how we leverage high-yield topics like microbiology, immunology, and biochemistry and apply those concepts all across your USMLE exam. And more importantly, guys, I'm going to show you how to actually study, what content and questions to focus on, and how to stay accountable and consistent in your study routine on a daily basis. So check out this entirely unedited live study session and see how working with me is going to help you pass your exam with confidence. I honestly feel that the test is very doable. I also feel that it's misunderstood. And a lot of individuals, because the exam was changed to pass or fail. I mean, I know for a fact, American med students, and obviously international, foreign, everyone for this matter, the scores are dropping. So I bring that up purposely because if you know what you're battling against, if you know what kind of exam you're about to take, then you can prepare. As simple as that. I'm a believer of knowing what is out to get me or what I'm supposed to be training for. Because if I'm going to live in my little bubble and hope I'm going to do okay and hope I'm going to pass on the exam on exam day, I mean, I hope it doesn't rain because I can't control that. It looks like it's a beautiful day, but I can control everything else. I had a phone call yesterday, well, a couple of phone calls with a few students about residency and about step 2. A lot of doctors out there have maybe an attempt on 1, an attempt on 2. It is definitely doable to get into a match process, to get into residency. It's just, you got to push hard, right? And I say this for a reason, because today is Friday. Friday, we do biochemistry every Friday morning. Tomorrow's the weekend. I don't see you guys until Monday morning. You need to be able to be consistent. The secret to all this prep is consistency. If you stay consistent and you stay disciplined, you're good. Now, they go, how can I stay disciplined? I'm in my home, my living room, in a dormitory, in a whatever condo or family, whatever you're at right now. Well, the way you get up in the morning and the way you go to a rotation, the way the school contacts you and says, hey, I think you need to go to Atlanta or Florida or somewhere in the States for your rotation. What do? You get up and you go, right? Because you get up and you go, you attend your rotations and you move. Same thing with this. You know, I do bring a lot of students on. I try to bring on some students a couple times a month to talk to you about what they went through, because hearing it from me it goes up to one level. After that, you tune me out. You're like, well, I know he says that, but maybe I'm different. No, you're not. Everyone is in the same boat. Everyone can do it. So when I have doctors come on board and talk to you all on Tuesdays and Thursdays mornings when we have our Q&A sessions, there's a reason why. The reason why is I want them to make you understand, I want you to understand that it's very doable. They did work with me for step 1. They did jump on board for step 2, scoring averaging 245, 250 plus. And you need to know what you want out of life. So as soon as these students work with me and our team, then I make sure they get into residency. I help them with LORs, meaning how to get them. We help them with personal statements. The point is, I need you all to get into the healthcare system to make it better, because it's not as good as it used to be. So you need to know what you're fighting for. So when doctors reach out to me and say, doctor, how do you do it? I'm not motivated. I can't keep going. You guys have to fire. You got to find it from within. Now, if you're with us every single day, it's simple. Use the Zoom link that you have, jump on, and I'll get you going. I just need you to attend. And I can promise you, I'll get you going every morning. And then by 3 o'clock, when we meet in the every afternoon Central Time, I'll get you pushing for the rest of the day. I didn't have that as a student, so that's why I provide this to our students. Weekends come, Saturday, Sunday, obviously you have to study. I always tell students, do what you can, do a little self-care, spend time with family, friends, go to the park, do what you got to do, because you got to keep staying in your zone. If you burn out, you run out of gas and the car will pull over, you will pull over. If you pace yourself, you'll do well. So today we're doing biochem. Now, If you're in our system, in our step one course, you know that we attack biochemistry every Friday morning. Why? Why not? Every afternoon we cycle organ systems, right? This program that for you all, you need to. I know most of you know, and some jumped on this morning, so you're not aware of it yet. But for me to make sure you pass your exam, I need to make sure you're able to put all the information you know from Boards and Beyond, Online Med Ed, Kaplan, Bootcamp, whatever your hearts, whatever you desire, right? Whatever you're using, Sketchy, Dirty Medicine, Ninja Nerd, whatever that is. And then the Q banks, hey, I don't care if you use Amboss versus UWorld. It's your exam. I love Amboss because of success. I love Amboss because I see results fast, right? If you're using UWorld, perfectly fine. Whatever I teach you today and every day, you can use in both. But I'm the person that's going to show you the content you know and the questions that you do to put them together. Because let me ask you a question before we begin. How is it that there's physicians all over the world that I'm very close friends with, and I most likely you guys and girls know people yourselves, colleagues, that are practicing physicians in their wonderful specialties of whatever, cardio, nephro. They're amazing at what they do, and they can't pass step one. They meaning, yeah, majority can't, because the test is not rigged in that way. It's rigged for us to make us feel stupid. You read the information, you study cystic fibrosis, you learn about McArdle's, about Pompe's, about von Gerke's disease, Corey disease, and then they throw a question at you. You're like, is this even English? What's going on here? That's why, guys, I'm not in the art of showing you every little content, because Online Med Ed does that. Boards and Beyond do that. Kaplan does it. They do it very well. But even if you watch those videos and then you complete UWorld once or twice, people still fail. Why? Well, that's where I come in. I want to make sure that A, you don't fail the first time. And if you have, let's say, an attempt, it's no problem. Come to us, we'll do it. The point is, everything is doable. So today we're doing biochemistry. We do that 4 times a month. And I know you all are like, well, come on, doc, let's start doing questions. You need to understand one thing. When you're answering questions, don't do what I used to do. I was told to do 2 to 250 questions a day. This is 12 years ago, and you'll do well. That was admin telling my whatever director, whatever was somebody, it was a representative, right, to help us out. That was a horrible advice. Well, it was good advice to a point, but not where I was. When a student starts off, you're not supposed to do multiple blocks a day, simulated, timed, random. You do that, there's no way you'll ever do well. And I can promise you won't, because that calls me up has the same story. Hey, I'm doing random 3-4 blocks a day. I can't go past 55% because you're doing it wrong. Just go back a step and learn your content. So that's why when I do questions with you every day, whether it's a Monday, Tuesday, Wednesday, we have different systems, different topics. I need you to understand that every question is different. Some questions are very easy because you just got to read, highlight the information, connect the dots, get the answer. That's like clinical knowledge, right? Like CK. This is easy. Other questions have random information that you must know. You need to know something from here to put into the scenario, right? And if you don't know it, you're in trouble. That's why I show you different techniques to say, well, you got to walk into the test knowing something. So if you don't know what the answer is, like I have wonderful questions that I've selected for you today. So this highlights why I do what I do and what I want you to do to pass the test. If you don't know what the answer is, don't panic. Everyone panics. They go, I don't know what the answer is. Easy, grasshopper. If you don't know what the answer is, do you know what the other answers look like? Do you know, can you eliminate some of the answer choices? And then next thing you know, you start feeling more relaxed. You start feeling more at ease. You're like, well, this is nice. My attending, aka US Assembly, tells me, go see this patient. There's 7 answer choices. I don't know. I mean, I hope I could read the question. Yeah, no. If you don't know what the answer is, look at the answer choices. Start knocking out answer choices. But to do the knocking out of answer choices, you need to know content. To know content, you need to read. To read, you need to study. And I laugh because I was a student, guys. I was in your shoes. I took my test. I passed. I need you to pass. And I'm telling you the secrets. You got to do it. If you don't want to do it, that's fine. And then you do it your way and hope you do well. But I'm telling you how to play the game. So we're doing biochem today. 3rd time around, I said it. I want you to participate. I have this 1-hour webinar in the morning and the afternoon because I want you all to jump on, raise your hands, participate. If you want to jump on live with me, trust me, I'm here to help you. So if you don't know it's something, we have our first aid, we have our friends, our colleagues in the chat, the whole system working together because we help each other out. I was thinking about it the other day when I think Anthony was on board or one of the doctors. The reason why I push you all to jump on live is because this is exactly simulating exam day. I'll give you a quick summary why. When you're home now, living room, kitchen, dining room, wherever you're at, library, whatever, there's no stress. You're by yourself, hanging in sweatpants, pajamas, whatever. When you get on live and you answer a question, I'm also very nice, but that actually starts getting you a little maybe nervous, a little stressful. You start maybe second guessing yourself, right? You're on the spot, AKA you're in the test center. So I started realizing, wow, I never thought about it that way. But the only thing I can never do is simulate how it feels to be there on exam day. I can't unless I create my own Prometric Center and have you guys jump on board. But there is something called a test drive, which I usually put in my training hub. Prometric has a test drive. You pay $30 for 30 minutes. So there's no excuse about performance anxiety, right? But when you're with me every day and you want to start feeling better, maybe you want to see how you will do under pressure, raise your hand, like some of you will be soon. Jump on, do some questions. We're here to help each other out, all right? So I will share you my screen. And as I answer questions and show you the different tricks and different ways to attack some, I'll help you navigate. I'll tell you, hey, listen, this is not worth it. This is very worth it. This you must know. This put on the back burner. When I was a student like you, like all of you, or doctors or students, if you're practicing already in other parts of the world, the worst thing I hated, that my biggest pet peeve was going to a course and reading a PowerPoint presentation or just telling me kind of what I know. Like I was like, all right, well, I can go home and study. I can go home and read all this. I'm here 8 hours in a classroom and you're telling me everything is in front. You're not giving me any extra value. But the people that I remember to this day, Dr. Goya and Conrad Fisher, people that I've worked with, that are my mentors, that I really, I hands down thank for them every day to help me get through what I had to get through. Those are the people that I appreciate it because they're like, hey, listen, you need to know this, stay away from here. If you have this question, watch out for this answer. Well, that's what a mentor does, a coach does, right? Tells you how to pass the test, not how to learn medicine. I mean, that's on you guys. You go to med school. I can show you ways to understand concepts, right? Ways that help me, but you got to do all that extra work to say, I got to learn my information. I'm here to mold it together. All right. So I want you to raise your hands. If you don't raise your hands, I'm going to pull some people from the group. Why not? I can do that easily because I could do whatever I want. I'm pushing you guys because I want you guys to push hard, right? Biochemistry is a topic that I love, and I tell you guys every single day you need to do well in it because they will ask you questions from everywhere. They ask you questions on vitamin deficiencies, toxicities, glycogen storage diseases. All the vitamins are important. Why? Because they're cofactors. If you don't have a certain vitamin, like yesterday we did hematology oncology. Yesterday afternoon we went over HemOnc, and some of you were there. So you realize that B6 is everywhere. So even though you do B6 in, let's say, in vitamin deficiencies, they pop up in heme because, hey guys, in the chat, why is that so important, B6? Especially when it comes to heme metabolism, heme synthesis. But the chat, guys, I want to hear chat. I want to feel the texting. I want to hear the typing. That's because, vitamin B6 is a big cofactor in the first step of reversible enzyme, right? To make actually heme. So if you don't have B6, you can't go past the first step of heme synthesis. Thereby, no heme. You can't combine it with globin to make hemoglobin, thus the anemia. Oh, and by the way, heme synthesis is in two locations, mitochondria and cytoplasm. And before we begin, there's 3 pathways you need to know in biochemistry that are in both mitochondria and cytoplasm. Do we know what it is? Do we know what they are? I mean, when we get together, we hug each other, right? We say, hi, good morning, hi, good evening. The word hug is very big. It's for both people to hug each other, right? Mother, father, whatever, parent, son, child. Heme synthesis, U, urea cycle, and G, gluconeogenesis, HUG, hug. These 3 are found both in the mitochondria and the cytoplasm. You think that's not important? It is. Because they'll ask you a question, they'll throw some question scenario, and they'll say, hey, where does this happen? You need to know the pathways that happen in the mitochondria in the cytoplasm, in both. So when we work together each day, as you all know here, some of you don't because you jumped on to this morning, and thank you for jumping on. We push you hard to make sure first aid is your friend, use the mnemonics and put it together to perform and score high. So that's why I do what I do, to make sure you guys go and move on to be the best physicians possible in this unbelievable, beautiful healthcare that we have today. Hey guys, I want to take a 10-second break and give you the opportunity to experience what it's like to work directly with me, live in these study sessions each day. Take advantage of the offer on this page and let's get you on a consistent study schedule. Work directly with me and you can pass USMLE with less stress and more confidence. I'll see you guys in our live study sessions. Okay. All right. I'm going to share my screen. Anna, and I'm happy she did because I was going to call her anyway. I'm joking. I'm joking, man. I'm joking. You know, I for all those of you who don't know, Dr. Anna, she's taking her test coming up soon. So that's why whether we have 10 people or 100 people, we work hard to make sure we're a team and a family, right? And I want to emphasize, I see this because this scares me. I want to emphasize that if you do know this question, whether you've seen it in AMBOSS or UWorld or whatever, don't say, I know, let's move. Find out why you maybe got it wrong the first time, or see what other answers are there that you should cover, right? Yeah. So Dr. Anna, you want to do this question for us this morning?
Yeah.
All right. I want you to implement the last 3-line technique that we have. I want you to show us what you know, right? What we do each and every day. And instead of just hitting the answer, I want you to walk us through your thought process and then tell us if you want to eliminate versus the answer choice. And then we go on the back and eliminate. And those of us watching, follow along, chat away. You know, I'll ask a lot of questions. I want you to answer. Okay, Dr. Anna, let me open this up here a little more because I know I'm going to share my first aid soon. So if you guys see this screen and this question, let's attack. Let's do it.
Okay, so the pelvic bones are tender to palpation. An X-ray of the pelvis shows thin cortices and multiple radiolucent bands that are perpendicular to the cortex and surrounded by a thin sclerotic margin. Which of the following laboratory findings are most likely present in this patient?
So before we continue, as you know, Doctor, and everybody else here, there's many different ways to attack a question. Every question is different, right? So Dr. Anna, in this case, we always do the last 3 lines, right? Do you see anything here that can lead you, not even maybe to the answer, but gives you an idea of what we're thinking about?
Like yes, like maybe
Okay. I mean, that's fine. That's fine. I mean, it's like to some people, the last 3 lines, like here, this X-ray finding should trigger something. Not saying it has to, it should. If it doesn't, it's okay. There's other ways to attack a question. Clearly, the presentation is the other way, right? They always give you a presentation, obviously the case, and they either give you X-ray finding, physical exam finding, a tumor marker, laboratory finding, something. So they gave us an X-ray. Some of you might know what it is, some might not. Let's go to the top and read the scenario and see if the presentation can give us some leverage on what the person has, right?
Okay. So a 60-year-old woman comes to a physician because of formal history of generalized bone pain. She has a 25-year history of Crohn's disease with multiple hospitalizations for acute exacerbations, including bowel obstruction last year.
Anna, stop there, Anna. We'll take a break. When a case like this, when it throws Crohn's disease, what sparks in your mind right away?
What, sorry?
What sparks? What triggers in your mind?
Malabsorption.
What do you think?
Malabsorption from like minerals or
yeah, there's issues with absorption, right? And this is something I hope you know. Some of you might, everyone is, I mean, the classroom setting, whatever, whoever we have in our room on a daily basis, everyone's at different levels, right? So it might be easy for some of you, might be hard for others, but then the other ones are easy for those and hard for you. So malabsorption. Now, you know, I can promise you there's so many cases that I do. Things are so easy. People are like, I couldn't see it, because sometimes you have a question in a random sense that messes you up and you forget the next one. So I can't have you guys not do on the easy questions. So Crohn's disease, malabsorption. All right, continue.
Current medication include mesalamine and bisoprolol. Her BMI is 19.5, and examination shows a soft abdomen and pale conjunctiva. Neurological examination showed decreased vibratory sensation over her lower extremities. Muscle strain is 4/5 in the distal groups and 3/5 in proximal.
So
Okay.
how do you approach a table like this, Anna?
So first I will say, like we were saying, so Crohn's disease, malabsorption of some like vitamin, and then I
Yeah.
see the table and also her symptoms of bone pain and the X-ray findings, and I will go for vitamin D. That's
Vitamin
the
D.
only one that makes sense for all of this.
So the X-ray is vitamin D, right? It's looser zones.
Mhm.
Also, we have now history of Crohn's. So now when you have obviously, like, let's say severe vitamin D deficiency, right? What happens to calcium?
Calcium is gonna go down.
Go down. What
Mhm.
happens to, because there's also malabsorption, right? What happens to, so this goes down. So we find
Yes.
all the down ones. Now, you can attack the question however you like. I usually go to the ones that make more sense to me. If I know a certain pathway, what goes up, then what goes down, I follow that along. It's never going to be written always this way. They could put PTH first, phosphate second, third. Who cares? Learn what each table, what each column is, and use it to your advantage, nobody else, right? Your advantage. So vitamin D deficiency leads to hypocalcemia. Okay.
Right.
Then phosphate up or down?
Down too.
Down. So we just got to do all the downs. Okay. So now we have a few, actually, this one here. Okay. But still, I want you to walk me through it.
Yeah.
So if calcium and phosphate is down, what
By
happens to PTH?
by reaction, it's gonna go up. Like I said,
Well,
it's down, so it's trying to compensate. Like,
yeah. Isn't the
right.
body awesome? It's like we don't have something. So the body says, I'll make it for you. I'll create a hormone that's going to stimulate more. This is nice. This is why you need to know primary parathyroidism, secondary hyperparathyroidism, or hypo, right? Primary, you need to know that. Okay. So PTH is high. Got it. What's alk phos?
Alpha first
Well,
in osteomalacia. That is
before you answer, I'm going to stop you. What is alk phos? What does that mean? Alkaline phosphate. What is this? What is this a marker of?
it's a marker of osteoblast, right?
So it's a marker of increase in bone turnover. That's all. Exactly. Yeah, bone turnover, right? So yes. So because of that, if you know what the markers are, that makes sense, right? So
Yeah.
calcium is low, phosphate is low. How do you think we increase? How do you think we increase calcium when the PTH is increased? How do you think that happens?
How we increase calcium?
Yeah, I mean, PTH is increased. So then, how do we then? What does that do to again get us back into having calcium again?
Okay.
PTH releases calcium,
Yeah.
right, in the bone into serum by increasing bone turnover,
So
which then that's
increase
why
ALT.
exactly.
Mhm.
So that's why we have alkaline phosphatase is high. So you guys have to. I don't want you to memorize what is up, what is down. You could if you want. It might not. It might not help in the future. What I want you to understand, as you know now already, is that calcium is down because of obviously malabsorption, and then phosphate's down too because obviously we have vitamin D deficiency. Then it's like, well, PTH is stimulated, okay, but then you got to figure out, well, what's alkaline phosphatase? I mean, the horrible thing is I mean, clearly you know what the answer is now because these two are the only ones that are highlighted like in the selection. But sometimes you might not be that lucky, right? So
Okay.
that's why if you do have a question like this, I want you to emphasize the breakdown step by step to then understand what everything is. To then say, okay, we know alk phos is high. Now, tables scare me, used to scare me because they're very up and down arrows. But if you just take it step by step and go to the column that you like, right, Dr. Anna, then it's a lot easier, no? What do you
Yes.
think?
Yeah, correct.
You have any difficulties usually when you have questions like this, when you do these kind of questions?
Yes, because I get scared. Like I see a table and I'm like, oh my God, I need to think too much here. Like it's gonna take me time, this question. So it gets me nervous but just that.
You know, why I ask you is because he used to always get me nervous.
Mm.
Amboss has a section study plans. They have questions specifically on tables like this. So if you know it's concerning you, if you know it's scary, if you know it's gonna affect your performance, why don't you just focus on doing as many as you can to eliminate it? I can promise you this is scary, but always read the scenario first. After read the scenario, just go pick and choose, because really I would say 70% of these kind of questions you can get just by what we just did. We had these two answers. We highlighted these two, already knew the answer. Well, that wasn't hard, was it? That's actually simple. That was easy, right?
Yes.
What we did was, person had Crohn's. We know it's vitamin D deficiency. Calcium and phosphate is low. Up, we got a winner. Take the win and move. Other times, you might need to know parathyroid. In this case, we were very lucky, but it's never. You don't ever have to know each particular column. It's usually 3 out of the 4, 2 out of the 4, because people are just confused. They don't know what it is. You don't know what phos was or PTH. You were lucky in this case. Other cases, you might not be. That's why I need you to know what each one is. And I'm being honest with you guys. I love UWorld. I just don't like the explanations too much. And honestly, I think UWorld is a great bank to use after you do Amboss, because it doesn't give you all the added bonuses that Amboss does. So in this case, if you have vitamin D deficiency, it leads to low calcium, low phosphate, right? By decreasing the amount of these two absorbed in the intestine. As long as calcium levels are low, PTH is secreted. There it is, to maintain normal calcium, what we talked about. And this is an example of secondary hyperparathyroidism. So if you got this right, I'm happy. I would then go, if you have this link, which you do in our training hub, you will go and look at every other answer choice, because I need you to know this stuff. PTH releases calcium stored in the bone into serum by increasing bone turnover. ALP phos levels, which is a marker of bone turnover, indicated here. If you don't know what that is, it's going to be hard, isn't it? Of course it is. Chronic inflammation of the ileum in patients with Crohn's can impair reabsorption of bile acids, fat malabsorption, so on. By the way, where is iron absorbed, guys? You could put in the chat, and Anna, you could answer. Iron. How about folate? Let's try folate first.
Okay, so iron is duodenum, and then because I know it by like memorization, so it's first.
So tell me what you know. Tell me what you know.
Yeah, proximal jejunum is vitamin K, right?
Keep going.
And then duodenum, it has 2, iron and calcium.
Keep going.
Then terminal ileum is vitamin B12 and that's what I know.
So I'll make it very easy for everybody.
Okay.
Because it's easy for us when we're relaxing on a Friday morning, and thank you for all being here with me, keeping me company. It's hard when you have millions of things to know, and then to recall it like this. So the word jejunum starts with J. If I take J and I flip, it looks like an F. It's folate, right? Folate. Then you say, well, then you have iron. Iron is one above. That's duodenum. And then one below is ileum is B12. So that's how I always remember it, because I'm giving you an example of how you should try to find how you remember it. So if you remember how Anna does, that's awesome. Me, I think of jejunum is folate. Then one above is iron. One below is B12. Boom, done. That I'm solid, because I don't want you to make a mistake on something that's so simple like that, right? And that's where they bank on you. That they expect you to get confused. That's why it's an 8-hour test, 7 blocks of 40, and it's random from everywhere, right? It's not like, well, the first block will be microbiochem and immuno. It's going to be 3 systems. That would be nice. That actually is more doable, right? I know the second block is going to be cardio, pulmonary, renal. Oh, no. It's any patient in the hospital. So that's why I'm pushing you guys hard. I need you to know this stuff. And if you put work into it now, it becomes easier later. Please don't jump and keep moving. It's difficult, 36%. I don't know why it's this low. I know it's because most likely the table itself, the arrows. But if you can get to the condition itself and know that it's talking about, obviously a person has Crohn's history. We're talking about vitamin D osteomalacia, which is the looser zones, transverse radiolucent bands. These are terms you must know, by the way. Then you move forward. And if you have issues with a question like this, what I would say is, whether using Amboss or UWorld, go to these answer choices. Go to 15. Check out what 15 is. Check out what 17 is. See what the issue is with these. Why do people choose these one after the other? and then say, oh, I get it now. I understand why this is not possible. And when you finish your block, you can appreciate the content for what it's worth. So it's a long scenario. There's always some information that can lead you to the right answer. You need to be able to come to a differential before you hit the answer choices. If you just jump thinking that it's something else, you might get it wrong. So the rule of thumb, the rules to take this one is they'll ask you about vitamin D, calcium, phosphate, alk-phos, PTH, no, primary, secondary, hyperparathyroidism, hypo. If you know that, they won't get you. All right, that's simple. I'm being honest with you guys. It can be very tricky. Look at the numbers, 36, it shouldn't be this low, but it is because I used to panic all the time. I see a table like this, man, it's hard, man. It's hard. It's not easy at all. So Dr. Cooper asked, please hit the alk-phos concept quickly. I'm not linking it with low calcium. So we said before, man, the low calcium and low phosphate, alk-phos is what? Alk-phos is what, guys? Anna, what's alk-phos again?
But bone turn.
Yeah. So PTH releases calcium, right? Stored in the bone. That's how, why do you think we have calcium if there's a PTH increase? So PTH hormone releases calcium that's stored in the bone into the serum. That's why we start getting high calcium, right? How? Increases bone turnover. It taps the bone, man. Because of that, there's elevated alk-phos levels. So when you see elevated alk-phos, the bone is being tapped. There's something going on. There's a reservoir. Where do you think the calcium comes from? It comes from the bone. So that's why we have increased, that's why we have alkaline phosphatase. This is important to understand when you're doing physiology, pathophys, and everything in medicine. If you don't understand what a marker is, that's a problem, right? That means you're not able to make the connection. You have to understand when levels are low, what happens when levels are low? The body compensates, like we talked about. PTH, what happens next, right? It gets calcium from the bone. Now you have calcium, and all of a sudden, automatically have alk-phos is high. If you don't know that, you won't be able to answer the question. Hey guys, I want to take a 10-second break and give you the opportunity to experience what it's like to work directly with me, live in these study sessions each day. Take advantage of the offer on this page and let's get you on a consistent study schedule. Work directly with me and you can pass USMLE with less stress and more confidence. I'll see you guys in our live study sessions. All right, Dr. We'll go for it. What's your question, man?
So basically, if my understanding is correct, is it that, because we had a similar question last week where we know that PTH is going to stimulate, stimulate 1-alpha hydroxylase to convert inactive to active vitamin D, and then that's going to lead to the stripping of calcium from bone deposits. Now, so in this case, is it fair to say that alkaline phosphatase is basically being acted upon by PTH, I guess, in an isolated manner, meaning it has nothing to...
It says here, if you can see here, it says here, so it's a group of enzymes, right? Found throughout the body, but produced in the liver, bones. So when you tap in the bone, this is released. So PTH is grabbing the reservoir of calcium, right? Where does it go? To the bone. So calcium is being taken from the bone, right? Obviously, because now you have calcium, and there's a consequence for that. There's a marker. That's why, for example, liver, why do we check liver enzymes? ALT and AST, Dr. Cooper. Why do we check liver enzymes for?
Well, yeah, we'll check liver enzymes to know to see how well the liver is functioning.
So if we have ALT, ASTs at 5,000, what does that mean?
Ooh, we got a liver disease.
No. There's a problem, right? There's a leak, yes. Right? There's something wrong. So we have markers in our bodies to tell us, the physicians, there's a problem somewhere, right? Because calcium can come from anywhere. But when there's alk-phos increase, that means it's coming from the bone, or it's coming from everywhere else, right? It says liver, bone, placenta, small intestines. Common causes of increased ALP, we have cholestasis, bone disease, right? Whatever the bone, as long as if you're tapping into the bone to get calcium, there's cancer, there's Paget's, whatever the case might be, you're going to have alk-phos. That's why when you're studying, ladies and gentlemen, you have to be well aware And if I see a certain marker, what does that mean? Oh, by the way, that also means you could be pregnant. Pregnancy has increased alk-Phos. So that's why when you go over these pathways, first of all, understand the concept of malabsorption, why we have low calcium and low phosphate, what happens because of that. And then, well, you say, well, increase PTH. Now we have calcium. How do we get the calcium, guys? Where do we get the calcium from? And then in response to that, alk-Phos is high. Does that make sense?
Okay,
Talk to me, Cooper.
Yeah, got it.
Well, let me ask you this. So when you study stuff like this, how do you read the material? How do you cover the answer choices? Because then I could do questions all day. But when I work with doctors like yourself, I want to make sure that you guys are connected, right? So when you're answering questions, you get them right or wrong, or there's something maybe you didn't understand or something you had to review. How do you do it? How do you conquer it? How do you attack it?
Okay, so looking at this question, if you were to scroll back to the arrows, okay. So, the minute well, if I was doing it, so like, and I read where it says that the X-ray of the pelvis shows a thin cortices, right? The first thing that starts coming to my mind is osteoporosis. Now,
Osteomalacia.
I'm sorry. Okay, osteomalacia. I know there's something going on with the bone. Now, the first thing that comes to mind is it will have issues with the bone. In this case, especially quote unquote thin. So I know that we've got a problem with calcium. So calcium is low. Then, if calcium is low in terms of the homeostasis, I would expect PTH, to be high, right? Just because it needs to activate the 1-alpha hydroxylase. And of course, PTH also being phosphate traction hormone, so I would expect phosphate to be low, okay, because it's being wasted. Now,
Good.
then there are two ways that it could go. So, for example, if in this case if C is obviously the only one with the down arrows for both, then
Sure.
I would select it. But imagine if phosphate was not an answer choice. Say we had just calcium, alkaline, and then PTH. Okay, I would have been looking at C still, but I would have had issues with overcoming the reading for alkaline phosphatase. So I think that's an area I need to hit and know exactly what the manipulation of alkaline phosphatase is.
Yeah, the reason why I'm asking you guys is because whether I have the videos in my online library, which you guys should access because I do it one-on-one, show you exactly what I do, but deeper. Because I also teach you the concepts the best I can, right? When you get down to this kind of question and you get it right or wrong, you really have to understand the basis of what everything is, right? This is leading to vitamin D deficiency, osteomalacia. Because of that, obviously the malabsorption as well. We understand these two. But sometimes they might not give you what you know. So you have to be able to understand step by step whether you get it right or wrong, hormone levels, what goes on in the body, whether it's repro, endo, GI, which we do this afternoon, right? That's the whole point, guys. Everything connects. Right now we're doing biochem, but there's a GI component to it. There's a biochemistry component, obviously. So the more you attack, the more you can connect. So rule of thumb, learn the terms. First, if you can get to the point of understanding it's low calcium phosphate, we're happy. Then you realize PTH is increased. Because of that, it gets the calcium from somewhere, right? It taps the bone. Automatically, this is a marker of many, which we talked about. And then that's why it's increased, because it's going to the bone, right? That's all it is. Take it step by step. And I promise you, the more you understand it, the better it is for you later. All right? Good? I got you, Cooper, man. Just give me time, man. Give me time. All right? Go to the other answer choices, guys. You'll understand. I have this question here. Why not? I want someone to do it. Who wants to do this one? Ooh, I'm going to start picking.
I can always work.
All right. Jump on this one, Doc. Go ahead.
Okay. The patient is asked to continually pump his right arm with the cuff inflated, and additional venous samples are collected at 2 minutes intervals. Analysis of the venous blood sample shows that over time, serum ammonia levels increase, and venous lactate levels remain stable. A biopsy of the right gastrocnemius muscle will most likely show which of the following. Okay.
Any idea about this? Sometimes you might not have enough content to lead you somewhere, which then you go to the top, right? Just depends on what you know versus what you don't. You want to go to the top?
Thinking of something because of the lactate staying stable, but I would like to read the case.
Okay, let's do it. Let's go to the top.
A 24-year-old man comes to a physician because of chronic fatigue and generalized weakness after exertion. His leg feels stiff after walking long distances, and he has leg cramps after climbing stairs. His symptoms are always relieved by rest. Urine dipstick shows 3 positive blood, and urinalysis is negative for red blood cells. Baseline venous lactate and serum ammonia levels are collected, after which a blood pressure cuff is attached to the upper right arm. Okay, so McCarley, something like that, right?
Before you do that, I want you to do me a favor, Dr. Anna. Can you go top to bottom or bottom to top, and can you give me, or I want you all in the chat to give me a letter. You choose what you guys all do yourselves. Give me the letter and give me what the condition is, right? So you choose wherever you want to go. I'm going to quiz everybody. You have A, B, C, D, E. You choose. Choose a letter and tell me what this description is of the condition, because they might not give you the conditions. Usually your assembly doesn't give you the actual disease. It tells you stuff like this, right? So please, Dr. Anna, tell me one by one what each one is.
Okay.
You know these, so that's what I'm asking you.
C. C is the mitochondrial one. In boys, they have seizures and muscle, but I can't remember the name.
Good. It's okay. So no mitochondria. There's Lasmilas, Elhan, something going on, right? Okay, mitochondria. Okay. How about this one? Dystrophin, endometrial fibrosis with absent dystrophin.
It's because dystrophin, I know, is for Becker and Duchenne, but endomysial, I don't know if it's endomysial fibrosis.
Well, you see absent dystrophin. So this is why I'm showing you guys what I'm doing, right? You need to know if you can go to the answer choices and actually quiz yourself and say, well, before I even read the question, I know what all these answers are. It gives you a better chance to get the right answer. Second, you need to not overthink. This is dystrophin, absent. It's either Becker's or Duchenne's, whatever, one or the other, right? Okay, we know this one. We know some mitochondrial issue. Okay, what's this subsacrolimal acid shift positive deposits? What's that?
That's a glycogen storage disease.
Okay.
Acid shift positive deposits.
Good.
Yeah.
What's this one? Now we have CD4, CD8. We did this in skin. We did that when we do skin, which we do every 2 weeks, right? We have a CD4, CD8. Which one is which?
Okay.
What is it? Uh-oh.
Okay, so
remember?
polymyositis is CD8.
How do you remember that, Dr. Anna?
Because the P, if you add like a circle below the P circle, is an 8.
I love it. That's what Anna wants to do. I like that she did it that way. We all do it a different way, right? I think of CD8, poly is many. Boom, polymyositis, done. However you want to do it, I don't care as long as you don't make a mistake, right? The CD8 lymphocytic infiltration is polymyositis. So this is polymyositis. This is something with dystrophin, obviously Duchenne's, whatever. Some mitochondrial stuff, okay. This is glycogen storage disease of some point. Now, what's this one?
Dermatomyositis.
Derm has 4 letters. Derm, I don't care how you learn it. So now we're able to detect every answer choice. So now you went to the scenario, and what'd you get from the scenario?
So from the scenario, what triggers first is that lactate, that is like really pathognomonic of this disease, and also that the cramps he feels when doing exercise that then relieved by rest, and the blood in urine and all that is what it takes me to McArdle disease.
McArdle's. Okay. So we take out polymyositis, Duchenne muscular dystrophy, or anything. Can we confident to take this out completely?
Yes. It will be also in pediatrics.
Usually it happens early in life. Okay,
Mhm.
fine, boom. This mitochondria out. This is derma, right? This is dermatomyositis out. This is the answer. 36%? That's scary, isn't it? I think it's scary. I mean, what I would do is either A, I think that people are not aware of what these really mean. And the only way, spoiler alert, the only way to get really good at it is to read every answer. Interesting how Dr. Starber says that every day. I do it for you guys. I already took my test. I want you to pass. So if you're going to go one for one, you're going to have to study a lot more. This is the secret, right? You get the question right or wrong. You need to understand it's McArdle's, right? Obviously, it's muscle weakness, myoglobinuria. It says positive blood, but there's no RBCs. That's an indication. You think it was myoglobinuria, right? And then exercise intolerance. They're going to tell you, hey, there's generalized weakness, and the more exercise, the worse it gets. And then when he relaxes, it's better, right? These are all different triggers, different points of entry to think it's McArdle's. Even if you didn't know it was McArdle's, let's say you're like Stavros, man, I don't know. You need to know what each one is here. If you know what this was polymyositis, which we went through, right, you would be able to know that that's not possible because furthermore, cramps are uncommon in polymyositis and muscle weakness is not profoundly exacerbated by exertion. You need to know what these ones are to have more confidence to get the right answer. Because if you're going to walk in to hopefully think it's McArdle's, I don't know. Look at the answers, 36%. Little scary, isn't it? So because of that, now I need to show you something. When you do these answer choices, you review them, you should know between derma and poly. That's A. B, when I tell you guys to always look at your first aid, well, this is the beautiful chart that we always look at, this table. We have Von Gerkes, Pompey, Corey, Anderson, which is never asked on the test, and McArdle. What thing? This guy always gets upset. Now, let me ask you this, Doctor. How do you attack a table like this? Because you need to know everything on this page.
Yes. So maybe like doing like differentiation between one and other disease.
How? How do you do that?
Like for example, Von Gierk, like the first one and the third one, Corey.
Yep.
Try to know, like, because they're kind of similar somehow. So maybe get one thing that is different that is gonna stand up, right?
Sure. 100%. Look, Von Gerke. It's a strong name. I think it's German. I don't know. Von Gerke, like Gurkha, Gerke, right?
Yeah.
It's both of these are similar. It says similar to Von Gerke. Okay, all right. Well, let's work through it. It's severe fasting, hypoglycemia is really low sugar, high glycogen in liver and kidneys, high blood lactate, high trigs, high uric acid. Do you see a pattern? High. Liver enlargement, renal enlargement. Liver does not regulate blood glucose. So Von Gerke is bad. It's the first type. Type 1 is horrible, right? The Corey is not bad. It's similar to Von Gerke, but it's milder, normal lactate levels, has maybe cardiomyopathy. So they'll give you a case where they say lactate levels are normal. So you're like, well, I know Von Gerke, I know Corey's. So now out of 5, you kind of know 2 already, right? Then the deficiency enzymes are big. CG6P, we know. Something like Pompey, they always give either acid maltase. So don't always remember one. No, try to know both. I always get tripped on the maltase one. So I made it. I was stubborn, and it was my purpose to never get it wrong ever again. Because the scary part is to know what the condition it is, to know what the person has, but then not get the right answer because you're expecting the answer to be in the answer choice. So they'll give you acid maltase. You're like, crap, what's acid maltase? Oh, Pompey, pumps, right? That's what we did on the day with Dr. Stavros on Friday morning. So to be fair, you need to know both this and this. It's 50-50, guys. They'll give you 1 or 2 of the answer choices. Or this debranching enzyme, it's kind of cool. Watch this. C, D. Well, Corey is the 3rd letter of the alphabet. And then you have C, then D. Every time I see Corey, I think of debranching. Well, C, D, the alphabet, right? And then if I see alpha 1-6 or 4 alpha, I always think it's this level. If I see maltase in it or alpha 1-4, it's always going to be Pompey. So you need to know this stuff. So when you look at this information, ladies and gentlemen, you should be able to understand how this was obviously McArdle's, because it tells you here, glycogen in the muscle, Muscle cannot be broken. Break it down. Painful muscle cramps because there's glycogen in the muscle and the muscle can't break it down. That's why a person is in pain, aka this person is in pain when they say, oh, is stiff after walking long distances and leg cramps after climbing stairs. Now you know why he's in pain. Oh, and by the way, red urine, exercise. Ooh, guys, word for word. So why is it that 36% got it right only? If you haven't seen it by now, you should realize it. This test isn't fair. You can understand it today on a Friday morning. Will you get on exam day? That's the problem, right? So I'm showing you how first aid's awesome. A table like this, you really need to take your time, either create a block in Amboss and do them, or just know how to differentiate them because they will play the game. They will get you. All right. Hey guys, I want to take a 10-second break and give you the opportunity to experience what it's like to work directly with me live in these study sessions each day. Take advantage of the offer on this page and let's get you on a consistent study schedule. Work directly with me and you can pass USMLE with less stress and more confidence. I'll see you guys in our live study sessions. I'm showing you the game, guys. The reason why is because I can. Here you go. I show you the game because I need you to understand that this is easy, but 36% is a shame. It shouldn't be that low. Dr. Alexa, jump on board, Doc. Thank you, Anna, for your time, by the way. Anybody can jump on. I hope you guys I hope you realize I want you all to participate. So thank you, Dr. Anna, for jumping on. Dr. Alexa, let's take it. I want you all to participate.
Question.
Dr. Alexa, good morning. How are you?
Good. How are you?
Doing well. Let's attack it.
Okay. Liver is palpated 1 centimeter below the right costal margin. Neurologic examination shows decreased muscle tone in extremities. Serum glucose is 95.
Okay.
And an X-ray of the chest shows cardiomegaly.
Okay.
Patient most likely has deficiency of which of the following enzymes?
Go to the top.
A 7-month.
Go ahead.
A 7-month-old male infant is brought to the physician because of 2-month history of fatigue and weakness. His mother reports that he has difficulty feeding, 20th percentile for height and 3rd percentile for weight. Physical examination shows enlarged tongue and crackles are heard at both lung bases. Ooh, okay.
And ask you a question. What does this mean when it says 20th percentile for height and weight or 3% for weight? What is that?
So
what is the indication?
50 percentile is like good. You want to be above that for kids. But if they're lower than that, like they're lower than average and there's most likely something else going on, especially the 3rd percent for weight, like that's really concerning.
So AK failure to thrive, right? Exactly. So there's not evolving. So they love to give you that. And they'll tell you failure to thrive, but they'll just basically tell you these numbers. Okay. So what are these answers again? Can you go maybe one by one and tell me what you know? And you guys put in the chat the letter, boom, give me the answer. Put the letter, give me the answer. Go ahead.
So acid maltase we talked about always being in Pompeii.
Pompeii. This one?
Myophosphorylase is McArdle.
I got you. Listen, I'm here, right? So McArdle, right here it is. McArdle's, boom, there it is. Got it. Let's keep going.
I'm not sure about C, but I know D is von Gerke.
Von Gerke, that's D. Von Gerke, we know it's the worst one, right? It has all the stuff that's high.
Yeah.
High this, high that. Okay. How about these we haven't done yet, but I mean, if you know it, right? What is this one? Beta glucocerebrosidase.
I'm not sure.
Help her out, guys. Gaucher's. Again, if you're watching online med ed.
Oh, is that for lysosomal?
Correct, yeah, because there's glycogen storage and lysosomal. So these are mixed up. You see, they're not all glycogen, right? So this is Gaucher's, okay. And what's alpha galactosidase?
Fabry or Fabry.
Oh, that's nice. So Fabry, is that X-linked or some recessive?
X, I think.
So X-linked, X marks the spot. They are all autosomal recessive except for Fabry and Hunter's.
Hunter, yeah.
Fabry, I think of the Fabergé Ag. It's a very beautiful jewelry, very expensive work, jewelry piece, stones and all that. And I think of it as going on a treasure hunt. X marks the spot. And then Hunters versus Hurlers. Hunter is X versus the whole list is AR except
Yeah.
for Fabry's and Hunter's. So this one, iduronate sulfatase. Iduronate sulfatase. What is that?
I'm honestly so stuck on that one. I have no idea what it
Don't
is.
be stuck. It's Hunter's. Hunters. Because when you have hurlers versus hunters, and we said how one is, they all are AR except two, right? Hurler is really bad versus hunter is a milder
Okay.
form of hurlers. But think of it this way. When you're a hunter, you practice, the bow and arrow, X marks the spot, and then your vision has to be pretty good,
Yeah.
right? Or else you can't hit the target. So, and you're really aggressive because you have to hit the target. So that's how I remember that when it's one versus the other, you see the beautiful L, then you have alpha L iduronate versus T for hunter, T iduronate
Hydronate.
to
Okay.
sulfatase. So that's why I'm showing you guys. So you don't have, again, would you get the question? I don't know if you're gonna get it, but if you get it, you're ready for it, right? So now we have a better indication of the answer choices. That's good. It's a good review. That's why retention is here. Don't try to review later. You won't have time. So reading the answer choices, what can we knock out like this?
I would get rid of the
Isn't it Cardinals?
no.
Because we have now cardiomegaly,
Yeah.
right? Cardiomegaly. We have issues with enlarged tongue. Glucose is fine. Decreased muscle tone. So is it glycogen storage or lysosomal? Let's go that way.
I
We
would
have Go ahead.
I would say muscle, like glycogen.
So we have, exactly. So if we think it's glycogen, if it's glycogen storage disease, we have normal glucose, issues with muscle tone, cardiomegaly, we can keep the glycogen storage diseases in. So
Yeah.
this stays in, this stays in. This is, remember, Hunter's X-linked, that's out. Von Gerke, we'll keep it in for the sake of it's in the category.
Right.
And this is Gaucher's, and this is Fabry's. So we were able to knock out 3 of the 6 just by knowing one versus the other. Because again, when you know as many as you can with the conditions, you're able to differentiate. Now, well, we know this is a Von Gerke, right?
No,
Why?
it's not extreme enough for it.
Exactly. Out. We need to talk about extreme levels, like Hunters versus Hurlers. Hurlers is really bad, right? Extreme. Von Gerke, bad. Acid versus, what is this again? This is Pompe's disease, right?
Yeah. So
And-
that's like that is
ahead.
cardiomyopathy and stuff, and hypotonia.
Well, there it is. This is similar to Pompe, is similar to Von Gerke, right? Pompe. Corey is different. Corey is similar to Von Gerke, but has cardiomyopathy, right? Heart, this pumping, what is it? Pompe trashes the pump, right? That's kind of cool to remember. Okay. So there's heart problems, there's hypotonia, exercise intolerance, enlarged tongue,
Yeah.
and almost the poor thing might die because systemic findings lead to early death.
Mhm.
Wow. You see? So now Corey's can lead to cardiomyopathy, but Corey's doesn't have the presentation that the case has. It has to be more to fit the presentation. So
Yeah.
this is an example, all of us, that if I go in and say, well, I'm going to choose cardiomyopathy as my finding. Yeah, but most of them have cardiomyopathy, for example, right? That's why we have to know as much as we can for every condition to then be able to differentiate the answer choice. If you're not, you're in trouble, right? So when you see enlarged tongue and you start seeing decreased muscle tone, it's clearly Pompe. Yeah. Plus, it's not McCardles to begin with. But if you thought it was Corey isn't even in here. That's just nice, isn't it? That sometimes knowing more of the other conditions gives you enough power, right? To go in and say, I kind of made a mistake with something, but I was able to get the answer anyway. That's all it is. That's all it comes down to, guys. So
even if Corey was in there too, wouldn't, like, because the child's failing to thrive so much, like especially being at the 3rd percentile for weight, I feel like that's still not extreme enough to be Corey's, right?
exactly. They will never ever
Too extreme.
make it that close, right? It's not possible because clearly one presents different than the other. So in this instance, like if you have multiple conditions that have diarrhea, they won't use diarrhea. They'll put it in the scenario,
Mhm.
but if you don't know the answer, you're missing a finding. Just like diabetic drugs, right? Some have weight loss, some have weight gain. Clearly, that's not the most deciding factor. They might throw issues with the kidney, with the intestines. Hey, listen, lactic acidosis or B12 deficiency, something of a deciding factor. That's why we all get tripped on. Oh, everything causes diarrhea. Yeah, but that I don't care about that. I need to know something more severe. So in this case, enlarged tongue was a dead giveaway. And normal sugar levels. That's it for the most part. Knowing that allows you to, plus cardiomyopathy, because even if you want to go both top and bottom cardiomyopathy, there was no CORI in the answer choice, and there's no hypotonia with CORIs, and there's no enlarged tongue with CORI. So you see, they use cardiomyopathy to lead you to a certain path, but then at the same time, you need to know all the other findings in Pompe. I think this. Let me ask you this: why do you think this question is so difficult, Dr. Alexa? Why is 35% choosing it?
I think people just don't know the enzymes. Like, I didn't remember that one, and like I could have. I don't know. I find sometimes if I don't know the answer, I'm like, oh, maybe it's that because it's so complicated that I didn't remember it.
Correct. I can tell you this has been going on for 15 plus years. Learn the enzymes. They're your friends. I can't emphasize enough. I can't tell you exactly what you're going to get on your test specifically. I can tell you what I feel you're going to get overall. So if you want to take a chance to say, I don't need to know this because it's not an NBME, best of luck. NBMEs are not an indicator of what you're going to get on the test. NBMEs are an indicator of how you're going to perform with the concepts that you know, right? There is no exam right now to this day that's going to say, this is going to be on that exam. It's very random from everywhere. That's why I need you to be good, at least 62, 65% on everything, to then get better. That's why we do this every day. We hit micro, biochem, and even every morning, typically 3 times a week, hit the organ systems in the afternoon. That's why, guys, or else many going in wrong, right? This is tricky. These are tricky. So what I want you all to do, including Dr. Alexa and everybody else here, when you're in the training hub, go to the link and just attack these questions. Quiz yourself, right? What are you doing to improve, Dr. Alexa? What are you doing to improve everything?
I keep up with that, reading the back of the book of the first aid.
Rapid review.
Yeah,
30 minutes, 20 pages.
But also I've been just trying to do like the tutor mode, and just like trying not to use the attending tip, but like even if I can narrow down like using the attending tip, I want to know all the answers. So sometimes it takes me a long time, but I'm learning like so much more just by going through the answers.
Good. I need you to take time. I need you to use the attending tip. That's pretty much us in that stupid button over there. Because I want you to do this. Read the scenario. Highlight where you think is what's pertinent. Come up with your answer choice. Say, all right, I think the answer is Cori disease, whatever. Hit the tip. Tip is going to say yes or no. It's going to say, hey, think this. It's either going to confirm that you're right or say, hey, crap, I didn't see it this way. Rewire the connection, look at the scenario, then move. And you know what happens now? If you get the right answer because a tip tipped you, that tells me, Alexa, you know the information. You just didn't connect it in the scenario. If you read the scenario, you think it's Cori, hit the tip, and you still get it wrong, then, ladies and gentlemen, you have to go back a step. You don't know the content. That's why I use Amboss for my diagnostic tools and purpose. Because if I open up UWorld right now, I can't tell if you know it or not. You answer the question wrong. Yeah, I knew the answer. Clearly, it's B. I can't decide that. But if I read the question right now with you, hit the tip, and you still get it wrong, it's a clear indication that you do not know the medication, right? I mean, or the medicine. That's a fair statement. So you need to use the tip. The tip is going to help you say, I'm going to save time. I'll summarize. Hitting the tip saves you time. Because I don't want you to go back and paint the wall that you always do. All of you guys keep studying. You read the same stuff over and over, you're still not doing well. It's because you painted the whole wall again, aka reading the whole chapter versus I got to figure out why I'm not getting it right. Is it the content? Is it a certain enzyme or whatever? That's why I want you to use the tip. Let's do this last one, Dr. Alexa.
There's hepatomegaly. Her serum glucose is 61. Creatine kinase 100, and lactic acid is within the reference range. Urine ketone bodies are elevated, and which of the following enzymes is most likely deficient in this patient? So we know if they're making ketones, then they don't have like enough glucose or they're not metabolizing glucose properly because
Sure.
you have to use proteins.
Mhm.
I'm just going to go to the top. 9-month-old girl brought to the physician because of 1 month history of poor feeding and irritability. She's at the 15th percentile for height and 5th percentile for weight. Examination shows hypotonia and wasting of skeletal muscles. Cardiopulmonary examination shows no abnormalities. So at least with a
So-
girl, we can get rid of any of the X-linked ones.
Go ahead. Well, actually, before we continue, top to bottom, run through them again. What is this?
Is that like, oh, that's McArdle, right?
McArdle's. Boom. What is this?
Alpha glucose, that's in,
When you see acid, every time you see acid in this, and it's always pompous. Acid maltase, acid. Anytime you see
Okay.
acid, there's always going to be pompase until parental wise on the boards, especially when all the answer choices are either glycogen or lysosomal, right? I used to, I was always mix, trust me, I used to always mix it up. Like the alpha glucosides used to mix up.
yeah.
Acid, every time you see acid, pompase, done.
Okay.
Acid destroys the heart, whatever you want to call it, right? Boom.
Okay.
Muscle, I'm telling you, because it happened to me, guys. That's why I'm like alpha glucoside. What the acid, pompase, McArdle's, pompase. What's this?
Von Gerke.
What's this?
Oh,
I'm sure.
we just had that one.
Oh shit.
Gaucher
It's okay. We got you. And this one, the D brancher is
is the actual
Corey, right? CD. Remember, guys, look at, forget about the glycogen. Look at the D brancher. D, that's C, that's Corey's. Acid, pompase. Because under stressful, this isn't even stress. This is just hanging out on a Friday morning. What happens when you're on the actual NBME or the 120 or the actual test? That's stressful, right? Plus, you're like, well, Dr. Savage, you just said live with you is stress. Well, yeah, you come on here, everyone's watching you. It's a sense of stress, but we do it for a reason. Okay. McArdle's, Pompey, Von Gerke's, Gaucher's, and Corey. How do we proceed?
So hepatomegaly sticks out for me. And that's not in Pompey or Corey.
So you have hepatomegaly. Okay. What else do you see here besides hepatomegaly?
They're not talking about any cardio symptoms
The
and
failure to thrive.
failure
that's
to thrive.
out.
Yeah.
We have liver enlargement. Okay. Muscle wasting. Okay. Muscles, wasting of skeletal muscle.
Mhm.
Okay.
Hypotonia.
And then hypoglycemia, low sugar. Okay. So we have a lot of stuff. What can we take out again? Well, lysosomal, right? Which is what? This one?
Yep. Gaucher.
And unfortunately, these are all in
Oh, yeah.
the glycogen storage diseases. So what are we comfortable taking out right away?
I would take out Pompey because there's no cardiomegaly, no enlarged tongue. There
Okay,
is
good.
hypotonia, but that I don't feel like that's enough to go on.
Because things can overlap, guys. I hope you realize you can't just, you basically walking into a test. If you just know 2 of the 7 symptoms or lab findings, you're just hoping they give you those. What if they give you the other ones? You're screwed, right? So learn them all. So this is acid maltase, Pompey. I have McArdle's. I know why they put this as A. Do you know why? Because when you see wasting of skeletal muscle, you're like, oh, muscle, McArdle's. But hold on a second. We have McArdle's, Von Gerke, and Corey. Didn't we say lactic acid is normal in some of them and not normal in the others? Like, what did we say about Von Gerke? What do we say? I don't want to look at it. What do we say about Von Gerke? Everything is high. Remember, everything is
Yeah,
high.
everything's increased.
Everything is high. Remember? So the reason why I jump in, Alexa, is when you guys are studying, I'm not with you. I don't want you just to kind of be busy. I don't want you to be, I want you to be effective, right? I don't want you just to memorize and read and highlight. I want you to say, you know what, Dr. Stavros, this makes sense, man. When you did it with me in the morning, I remember, all I remember was Von Gerke is the first one, and it's bad, meaning everything is high. It's low sugar, right?
Yeah.
High glycogen, but there's high blood lactate, high trigs, high uric acid, aka gout, big liver enlargement, renal enlargement. But this one here, lactates are normal. We said, remember, Corey is not as bad. It's similar to Von Gerke, has maybe some heart stuff going on. Obviously, lactate is normal. So when you see lactate is normal, you take out Von Gerke right away. You're like, out. All right, this is easy. Now you're down to 2, McArdle's and McCordles. McCardles, though, is this. We did it before, right?
Yeah.
They're going to have to give you some things, guys. They're going to have to use some more of a presentation specific to McCardles. Is that correct? Like myelophosphorylates.
Yeah. If
Obviously,
it's like painful muscle cramps and stuff like that too, I feel like you'd have to see it like in older, you know what I mean? Because a baby can't really express
yes.
muscle
Yes.
cramps and all that.
Yes. Why 29%? You see what I'm saying? Like, this is because all of us, I was in that pool at one point. I'm like, it's too hard. I don't want to memorize it. Well, all right. I'm showing you ways how to not memorize, but to kind of leverage the game, right? So when you go, and even if you got this wrong, let's say, or got it right, I'm curious of why people chose this. I'm always about curiosity, right? Muscle glycogen phosphorylase leads to development of McCardles. It presents with, during adolescence, early adulthood, exercise intolerance, muscle cramps, weakness, myoglobinuriria, elevated CK levels. Although this patient has hypotonia, her early presentation, liver enlargement, and low sugar is inconsistent. So all this stuff, it doesn't happen in freaking McCardles, which tells me no one knows what McCardles is, or else you would not have chosen this answer. 18% chose it and they got it wrong. You see, because they rush, they jump, they pick with a finding that they like. They say, well, I'm going to choose this one. Okay. You didn't choose the right one. You see what I'm saying? I think they saw CK, creatine kinase, and they saw muscle wasting, and they went to McCardles. And the test writer is happy. He's laughing. She's laughing because this is what they did. They purposely did that to lead you to this answer. And it's wrong because that's not the case, right?
So
The case
McCardles
is-
too, anyways, we could take out if we wanted to go by age, right? Because
You
it's
could,
adolescent.
sure. Of course, it usually happens adolescence, early adulthood. Yeah, not a 9-month-old. So if you know timing and age, you're solid for the boards. As you realize with neuro, with tumors, right? Young versus old, location, and obviously smoking associations. But if you don't know the actual age, it's okay. You have other findings. Think of it as like musical chairs, right? You need to know, you keep moving them around. If I just cycle it out and give you two of the findings that maybe you're not familiar with, you won't know. So if you know the age, you can get it. If you know the presentation, and if you know the other answer choices, you can knock them out. So you have multiple ways to answer the question. Makes sense? So Anna might say, I want to do it this way. Dr. Alexa goes, you know what? I saw the age. Boom, I'm taking out a couple of them. That's fine too. But be careful. You need to know the findings to give you enough power. That's the whole point. Because like what Monica said, yeah, CK is high, wasting skeletal muscles. I can understand why people jumped into the muscle phosphorylase, which is McCardles. So be careful, guys. All right. Take your time with all of them. Why they go to von Gerke? Why? Because of liver enlargement? Okay. But what else do you have to see in von Gerke? Severe fasting hypoglycemia, which this person is at 61, not 30. Lactic acidosis, this is normal, right? There it is. And hyperuricemia. Well, this person doesn't have gout or hyperuricemia. So you see, when you go back and read first aid, isn't it nice to say, well, instead of memorizing everything, let me just figure out how I can leverage it. This is really bad. Everything is high. This person does not have high lactic acid. So all of our colleagues at 36%, they chose that. I don't know why. They like you said before, liver enlargement. So that's why I stopped you, because if you just look at this is one of the few that you need to connect, right? So make sense? Alexa, you happy?
Yeah, that was good.
I mean, I want you guys to understand that this is all going to help you. If you're part of the system, you get access to the links, which I provide. We share these links here. I always share the questions that I choose into my training hub for all my doctors to access, because I need you guys to do well on this test. So today is 9 questions, because every Friday we do biochem. So I want you guys to do the rest on your own. This is important. Aldolase B, GALT, fructokinase, kinase is kinder. This is what we do each day, guys. You need to know this information. If not, then what happens is you better be good at everything else, because they're going to get you in other content. So my job is to make sure things that I have control over, I can increase for your sake. Like obviously kinase, kinder, everything with glycogen, lysosomal, vitamin deficiencies, vitamin toxicities. All that stuff together gets you points. How do you feel about biochemistry so far, Dr. Alexa?
I've always hated biochem. But
You,
but
you
I like the diseases better. Those make more sense. It's like when they ask random stuff in glycolysis and stuff, it just bores me to death. So I hate it.
So I bring this up before we go for a reason. Biochem is very challenging. Either you love it or you hate it. If you're studying for it now, I would suggest for you to do metabolism first, hit vitamins, toxicities, unfortunately, glycogen, glucose, glycolysis cycle, gluconeogenesis, all that stuff you need to kind of get through. But it's clinically related. The genetics, don't worry too much about the pedigrees. Learn more of the traits, examples of each. So whatever the condition we're doing, like we answer all these different organ systems every day in the afternoons. I want you to keep track of how to know the distribution. Is it AR, AD, X-linked, and so on. Then after you do genetics, the last on my list is DNA protein. That is straightforward, not impressive. It's not skillful. You got to open up your book, open up a couple of questions, and answer the questions. It's basically, that's what I would do if I was you all. It's terminology. If you don't know ligase, primase, DNA polymerase 1, 2, 3, you will not get the answer right. So open up your first aid or your textbooks or your resources, open up AMBOSS, create the link, do the questions in a focused manner, and get those points, right? So this is what I do every day. So biochem is your friend. You don't have to love it. You just utilize it to get points. Makes sense? You got to do well. Any other questions before we go today? No questions?
I just had a quick question. Real quick.
If it's quick, Anthony, bro, 10
It's going to be
seconds.
super
10
quick.
seconds, man. Put the timer on.
Like, not that I don't know if you're going to be able to answer it, but like, who named these enzymes? Because like, I got tripped up like a couple of times today, particularly with the mixing up the alpha and the acid, like the glucosidase versus the galactosidase.
Yep. I'll answer your question. So, at the end, yeah, who really knows who named them? But I'm gonna say this because I've said this before. When it comes to this exam, in the past, when it was a score, like obviously it was through a numerical value, we wanted a high score. Online med ed, I know the guy I would talk a little more often than before. He's amazing with CK in step 1.
Mm-hmm.
He even says in his videos, he goes, man, if you get a 260, watch my video. If you're not trying to get 260, just move on. The point is, it trips everybody up. We all hate those enzymes because they make no sense. This is where memory comes in, right? Or little hooks that I showed you, A versus B, C versus D. So every time you see acid in the context of those, it's always pump it. Because I used to always mix up the names. Even today I do sometimes, right?
Mm-hmm.
So if you know the presentations, like literally look at the first day like I showed you and say, okay, the first one, von Gerke, has all these symptoms. I promise you're going to be almost there. Then you might say, Dr. Stowers, but look at the answers, man. If I don't know what the answers are, how am I going to get it? You don't have to know them all. Just know some of them. So by elimination, if you could take out von Gerke, which is easy to remember, McArdle's muscle phosphorylase, you know that. Corey's is a debrancher, and then acid is that Pompeii thing. Man, you have more power than the average student. So don't worry about that. That won't make you or break you. I'm just showing you techniques. So to answer your question, I don't know who writes them. I think it's a pain in the ass personally, but play the game to win. So
okay, just a quick follow-up on that. Like, how often did you see for the debranching enzyme, like that second one, the transferase as an extra choice?
Hold on, let me show you. So this one here. You're talking about this bad boy here?
Yeah.
You're talking about under the Corys, you mean? These guys?
Yeah.
I mean, let's put it this way. If we know von Gerke is always G6P, and we know that McArdle's is always myophosphorylase, glycogen phosphorylase, we're good. 2 of the 5 were covered. Anderson, poor thing, is never asked, but if it's asked, always see is Anderson is the branching one, Corey is the debrancher. A, B, C, and D. Fair. So to overall answer your question, if you know this one, and you know this one, and you kind of know this little bad boy, you're down to 2. I would just know this one And by default, if I see alpha 1,6 or 4 alpha D, blah, 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 it's the Cori, right? Versus I can guarantee whether it's lysosomal acid alpha 1,4 or acid maltase, do you see a common denominator? They're both acid, right?
Yeah.
So clearly they're going to put acid in the answer choice. So in that context, this is not worth losing sleep over. I just brought up to show you guys that it's doable. You leverage, because clearly I can't tell you what word for word you're going to get in your exam.
Mhm.
But when you have this kind of table, first aid's full of these tables. So take this disease and put something else. Let's say RTA 124. I don't care. You need to learn how to read these tables. So don't read word for word. Leverage it. Say which is more severe, which is very similar. Okay, what's crazy about each one? Got it. And do some questions. So then later, when you see this one, it's always this one. This acid, I don't care what it is. It's always going to be pump S. Acid's always pump, right?
Okay.
D branch is always C for Cori, with all these crazy exotic names. And then the last one is going to have muscle phosphorylase or myophosphorylase in it. That's it, man. That's all it is. Play the game to win. Now you see Anderson, though, has hepatosplenomegaly, failure to thrive, infantile cirrhosis, muscle weakness, hypotonia, cardiomyopathy. Sounds like the other ones, don't they?
Mhm.
But when a little rule, when it's really severe like that, it actually sticks out, just like the one that has enlarged tongue. So if you had to learn it, you say, well, cirrhosis, only one causes it. It's Anderson causes cirrhosis. There's two things that the kids can die early. Pompe is number 2 and number 4. They're both even, 2 and 4. So be a better test taker, right? You guys went to school. You're medical students and physicians. I'm here to teach you to learn the content faster and hook it faster to recall it faster, right?
Mhm.
And by doing that, it allows you to do well in the exam. So no one ever taught me this way. I would read the table and say, all right, here's the first one, here's the second one, here's the third one, and I would still make them wrong, still get them wrong, because I didn't understand how to read the table. I'm showing you how to do it in 5 minutes or less. Look at the most severe case, see if there's any similarities. Learn the enzymes are easy. The other ones come with time. And this is applied to every table in first aid. You just got to do it. Fair?
Thanks.
Anthony, your quick question, I always give you the long answer because that's what I do, man. I always give you
Fine. I
the
appreciate it.
long story, but the stories is what allows me to remember doctors' lectures 15 years ago. That's why what I do is a product of what I was taught. Like I know I got to keep you guys entertained. I got to keep you guys energized. I got to keep you guys interested. If I just say, this is this, this is this, this is this, you guys will check out 35 minutes ago, probably even longer. I need you guys to be aware that this is very easy. You just got to do it, man. So when you get a question like we did before, like this one, no, we got to go anyway. It's running late. But this one, galactokinase, what's the debranching again?
That is your that's your alpha 1,6 and your glucotransferase.
So when you see debranching, it's always going to be
debranching,
Cori.
right? Yeah.
Debranching is always Cori. Debranching is always Cori. So this is going to be Cori's, right? This is called aldolase B. I need you guys to do it on your own. G6P is von Gerke. So by default, I can take out probably this one, because I haven't read the scenario. But you have all these other answer choices. If you know what the answer choices are, you're in good standing. Simple as that, right? So take your time, go from there. Sounds good?
Sounds
So
good.
the list is going to be on the training hub for you guys to have access. You'll see the link there. Click the link, answer the questions. I do not see the performance on those questions, so you have to let me know how you did. When I expose these questions to you, you should then say, do I know it or don't I know it? That's the problem, right? I need you to be aware of things so that when you are studying on your own, we have the study plan in the training hub, immunology, microbiochem, and the rest that's lined out for you. We do it together. Have an amazing morning. Thank you for staying longer with me. And I'll see you guys this afternoon, which we're doing gastroenterology. GI, it's a wonderful topic. All right, guys. God bless. Have a great day. See you guys in the afternoon. Thank you for your time. All the best. Bye-bye.